friends, myself Dr. Maria. So I'll be taking the pharmacology sections for you. Pharmacology is a very interesting subject. Only thing is you should understand the concepts and learn. Okay, and it is very essential, and you have to keep pharmacology throughout your practice days. Okay, because you're not supposed to prescribe any drug about which you don't have a complete knowledge. Okay, and what it does to the body and how the body reacts to it, what are its side effects. So all these things will be learning in pharmacology. So we divide pharmacology into general pharmacology and systemic pharmacology. So we'll start with general pharmacology, where we'll see the important concepts, the general concepts, and then we'll go into each system wise. Okay, the drugs acting on different systems. So today's session is an introduction, plus we'll discuss on routes of administration. So before we go into that, we'll see what are the important questions that has been asked from general pharmacology in your previous university questions. So mainly essays is about the various routes of administration with examples, with merits and demerits of any one or two routes, mainly oral route. Then another essay question is about various adverse drug events, and they may ask about a specific adverse effect or explain about, like as in case here, any three important adverse reactions. And then general treatment of poisoning. The short notes usually asked are teratogenicity, special drug delivery system, therapeutic index, drug tolerance, plasma half-life, biological half-life, biotransformation, what are the factors modifying drug action, and microsomal enzyme induction. So we'll see each of these topics one by one. So let's go to the introduction. So what is basically pharmacology? Pharmaco means, it's a Greek word that means drug. Okay. So pharmacology is a science that deals with study of drugs or other medicinal products and what it does in our body. Okay. And what are its effects on the functions of living system. So as I said, it's a Greek word that means drug. And what is drug? Any substance that is used to prevent, diagnose, treat or cure a disease is what is known as drug. Drug is a French name that is derived from drogue. Okay, so any substance that is used to prevent or that will help in diagnosis or treatment of a disease, we call it as a drug. Okay. Now, there are certain terms that we usually come. Okay, there are certain definitions that you should know before we go into the other concepts. So, one is pharmacogenetics. What is meant by pharmacogenetics? Pharmaco means drug. Genetics, you know, with relation with the DNA. So, it is a study of genetic influences on drug is what is known as pharmacogenetics. When we learn about what are the factors that modify drug action, we'll see in detail about pharmacogenetics. And pharmacogenomics is when we use this information, that is pharmacogenetic information, to decide on how to treat the patient. We call that as pharmacogenomics. Okay, these are different branches of pharmacology. Then we have something known as pharmacoeconomics. You just need to know what is meant by these terms. You need not go into in-depth, you don't need not have a knowledge, but you should be familiarized with these terms. So pharmacoeconomics means, pharmaco again means drug, economics is something to do with money. So you are quantifying in terms the cost as well as benefit. We are saying the cost benefit ratio. There are different types of pharmacoeconomic analysis where we'll weigh out the cost of the treatment and the effectiveness. So we take into account the quality as well as quantity. Both quality of life is also a part of this evaluation. So this is mainly we undertake these kind of studies to see whether policy changes and all, whether this particular treatment modality has to be included, whether the government has to support for this treatment modality, because whether the benefits will be compared with the cost, and then they'll decide. So for that we need these kind of studies. Now, what is meant by pharmacoepidemiology? Epidemiology we know, which is study at the population level. So when we are using or when you are studying the effect of drug use at a population level, we call it as pharmacoepidemiology. Now, what is pharmacognosy? It's a study of medicinal plants that are obtained from plants and other resources. The drugs obtained from medicinal plants and other resources. Now, right from the first class onwards, you will be hearing these terms pharmacokinetics and pharmacodynamics. So, you should have a thorough concept of what is meant by pharmacokinetics and what is meant by pharmacodynamics. So, what is meant by pharmacokinetics? Kinetics means what? Movement, right? So, what are we studying here? Pharmacokinetics, that is a movement of drug in the body, and what the body does to the drug is what is known as pharmacokinetics. What does the body does to the drug? When we take a drug, what happens first? The body will absorb it, okay, and then it will get distributed to different parts with the help. It gets enters into the brain. It undergoes circulation, so it gets distributed to different parts of the body, and then it brings about its action. It undergoes metabolism in the liver, okay, and finally after its action everything is over, it gets excreted out of the body. So this is a journey of drug in the body, and this journey is what we call as, or study of this journey is what is called as pharmacokinetics, okay. So what the body does to the drug is what we known as pharmacokinetics. So study of drug movement and alteration of the drug by the body is what we call as pharmacokinetics, otherwise known as ADME studies. Why ADME? A stands for absorption, D for distribution, M for metabolism, and E for excretion. Okay, so the study of drug movement and alteration of drug by the body is what is known as pharmacokinetics. Now, what is meant by pharmacodynamics? That's the other term. Okay, dynamics. Remember D for the drug. Okay, what the drug does to the body is pharmacodynamics. So, what the body does to the drug is pharmacokinetics. That is your ADME studies. What the drug does to the body, that is, drug will go, it will act on its receptor. Based on the mechanism of action, it will bring about different pharmacological actions. So, study of those things, the biological effects produced by the drug or what the drug does to the body is what is known as pharmacodynamics. Okay. So, I hope this terms are clear. What is meant by pharmacokinetics and pharmacodynamics. We'll see a little bit more in detail in the next classes. Pharmacokinetics, how does the drug gets absorbed? How does it get distributed? What is meant by volume of distribution? What are the different methods by which the drug gets metabolized? How is it getting excreted? Then we come to the pharmacodynamics, where we study about different receptors, how it acts, and what are the biological effects that it produces. Okay. So, biological effects produced by the drugs, site and mechanism by which these observed effects are produced is known as pharmacodynamics. Okay, clear. Now, before we go into the routes of administration, we have to familiarize with certain terms. One is a drug nomenclature. So, this is by Drugs and Cosmetic Acts in 1940. The drugs have been given three names. Okay, one is a chemical name, other one is a non-proprietary name, NPN, or generic name, otherwise known as generic name, and the third term is a proprietary or brand name. So, as the term indicates, what is meant by chemical name? It is based on the chemical constituents. What is a non-proprietary or the generic name? That is, as by an agreement by the WHO, there will be a common name to the drug. And what is a proprietary or the brand name? That is the patent property of a particular brand, which is easy for the physicians as well as for the patients to remember. To promote the product now, we use this proprietary name, which is commonly known as a brand name. We'll see with an example the three names. The common drug which we have all known, aspirin, otherwise known as Ecosprin. So, what is it actually? It is acetyl salicylic acid. What is acetyl salicylic acid then? It is a chemical name. Acetyl salicylic acid is a chemical name. What is aspirin? That's a non-proprietary or the generic name. But there may be different brands for this aspirin. One such brand is Ecosprin. So, hope you understood the difference between the chemical name, the non-proprietary or the generic name, and the brand name. Okay. Then whenever you see, next time when you take a tablet, even paracetamol, when you take a tablet, please see the back side of the tablet. There are so many things that are written in very small letters on the back side. Please go through it and try to understand what does it mean. Okay, there are certain abbreviations that you see, IP or BP or USP, BNF and all. What are these terms? These are pharmacopoeias. What is meant by pharmacopoeia? Pharmaco means, you have said, drug. Poeia means to make. So it's an official publication that contains a list of all the approved drugs and the medicinal products, and it contains all the essential information about that particular product, how to prepare it, what is its purity, what are the physical properties, what are the source. All those information will be contained, and each country will have its own pharmacopoeia. So we have an Indian pharmacopoeia, British pharmacopoeia, United States pharmacopoeia, and there are different formularies also, again, that contains information about the drugs that are available, like British National Formulary. So you can see here, I'm not sure whether it's very clear. You can see here a IP is written here. So that means Indian Pharmacopoeia. Okay. Now what is meant by expiry date and shelf life? Expiry date is the date up to which the active ingredient is expected to remain within specification if it is stored according to the company's instructions. That is the expiry date. Shelf life is a time between the expiry date and the manufacturing date. So you can see here there is a manufacturing date here as Jan 12 and expiry date as December 14. So what is the expiry date here? That is 31st December 2014 is the date up to which the drug will, the active ingredient is expected to remain as such if it is stored under proper conditions. But beyond that, the companies cannot assure for its quality. And what is the shelf life here? It is manufacturing date is January 12. Expiry date is December 14. So shelf life is 3 years. Okay, so that is meant by expiry date and shelf life. Then there are certain schedules that you should be familiar with. One is the Schedule H. That is, these are drugs that should be prescribed, that should be given only on prescription by a registered medical practitioner. For example, antibiotics and all come under Schedule H. Okay. Then there is something known as Schedule X, that is for narcotic and psychotropic substances like morphine or sedative hypnotics and all will come under Schedule X. So again, this should be prescribed, given only on prescription by a registered medical practitioner, and the pharmacist is supposed to retain the prescription at least for a minimum of 2 years. Okay. Now, what is meant by OTC drug or over-the-counter drugs? These are drugs that can be given even without a prescription. Okay. Now we come to the routes of administration. So the earlier we have discussed about what are the common definitions, common terms, pharmacokinetics, pharmacodynamics, the drug nomenclature and all. Now we come to routes of administration. So what is meant by routes of administration? It's a path by which the drug enters the body. Okay. So we have local routes. That is, it can be a topical route when we apply it over the skin and mucous membrane. Then to the deeper tissues, like when we inject it into the joint space, that is intra-articular route, or it can be intra-arterial route when we are doing it for coronary angiography and all. It is intra-arterial route or intrathecal route. That is when you are giving it to the spinal space, or when you are infiltrating a nerve for a dental procedure. That is a deeper route. Okay, so these are all local routes of administration. Then we have systemic routes. Systemic routes is divided into enteral and parenteral. Enteral, the word meaning of enteral means GIT. So anything through GIT will come under enteral route. That is, your oral route, rectal route comes under the enteral route. Parenteral means anything outside the GIT will come under parenteral route. That can be different types of injections, inhalations, or transdermal and even transmucosal absorption will come under parenteral route. So now we'll see each of these routes one by one. What are the merits? What are the demerits? Examples of drugs. So this is relatively a simple topic. If you just use your common sense, you'll be able to remember it. So basically you remember the routes of administration divided into local and systemic. Local means when we apply it topically, or when you're giving it to deeper tissues like intra-arterial or intrathecal, or when you are giving it intra-arterial. Intra-arterial also we call it as local because we are giving to a particular artery only, not to systemic. Then systemic routes, we have enteral and parenteral. Enteral means oral or rectal. Parenteral means different types of injections, inhalation, transdermal, all will come under parenteral route. Okay. So now we come to one by one each route. The most important one is the oral route. What are the merits? You can think about the merits of the oral route. What are the merits of the oral route? We all have taken tablets. We all know the merits. It is very easy to administer. Self-administration is possible. It's cheap. It's convenient. Relatively easy to, it's a non-invasive method, and it's a commonest mode of administration. So these are all the merits or the advantages of the oral route. What will be the disadvantages or demerits of the oral route? You know, oral route, when you take, the drug undergoes first pass metabolism, or other type of metabolisms are common when you are taking it by oral route. So it is slow absorption when you are giving it by the oral route. If you are unconscious, if you are vomiting, you cannot give it by oral route. Okay. Then irritant or unpalatable drugs cannot be given by oral route, and this we have already said. The first pass metabolism. So drugs with high first pass metabolism cannot be given by oral route, like lignocaine, which is local anesthetic, have very high first pass metabolism, so you cannot give it by oral route. Examples of drugs given by oral route, you have n number of drugs. You can say paracetamol, diclofenac, or antibiotics. All these can be given as examples. Okay. Merits, demerits. Next, we come to sublingual route. What is meant by sublingual route? When you are keeping the tablets under the tongue. Sublingual route. What are the merits, or how does this drug gets absorbed? We're keeping it under the tongue. So it is getting absorbed through the buccal mucosa. So main property that drug should be having in order to give it as a sublingual route is it should be lipid soluble. Then only, we all know that our skin or other mucous membrane contains a lipid bilayer. So only if it is lipid soluble, it will be able to absorb. Okay, so that is a foremost condition for a drug to be given as a sublingual route. Common examples of drugs that are given by sublingual route. You all know the sublingual nitrates, which we give for a acute anginal attack. Okay, so nitrates is a common example you can remember. Then buprenorphine, which we give it for smoking cessation. Des-aminooxytocin, it's a form of oxytocin. All these are drugs that we can give by sublingual route. Nifedipine is another drug which is an antihypertensive, which is available in sublingual form. Now, what are the advantages? Since it is getting directly absorbed into systemic circulation, it bypasses the first pass metabolism. Okay. Then once its action is over, you can spit it out. So there is quick termination of action once the desired effect is obtained, and therefore less side effects also. So one is it bypasses the first pass metabolism, quick action, less side effects. Okay. What are the demerits? Since you're keeping it under the tongue, there is chance for buccal ulceration, and only lipid soluble drugs can be given. Lipid insoluble drugs cannot be given. Now next we come to the rectal route, that is in the form of different suppositories. We give the drug through the rectal route. So you can see here, this is application of a suppository. So drugs like paracetamol, especially in case of children, we may use that as suppository. Diazepam in case of febrile seizures and all, we give it by rectal route. So what are the advantages? In case of chronically ill, in geriatric patients, in pediatrics and all, it may be beneficial. It can be given in patients who are unconscious or those who are vomiting also you can give. And 50% of the drugs that we give by this rectal route directly enters into the systemic circulation, bypasses the first pass metabolism, and it can be given even by an unskilled person. But the demerits or disadvantages is, just like in buccal route, rectal route also can cause inflammation or ulceration around the buccal, around the rectal mucosa, and sometimes the absorption is unpredictable. It can be erratic and incomplete absorption when you are giving it by the rectal route. So that is about the enteral routes. That is oral route we have discussed, sublingual and the rectal route. So next we discuss about the transdermal system or transdermal therapeutic system. We call it as TTS. Okay, what is meant by transdermal system? It is a method by which the drug or the medication enters into the body by diffusing through the skin. Okay, usually in the form of a medicated patch. Okay, so it has got different layers. This patch has got different layers. One, we have a contact adhesive that will help the patch to adhere to your skin. Then there is a drug reservoir, okay, and a drug release membrane. So there will be a drug reservoir here. Behind that, there will be a drug release membrane. So through this drug release membrane, the drug that is contained in this reservoir will be slowly diffusing into the body. Okay, and then there is a backing layer. So these are the different parts of the transdermal patch. So these are adhesive patches that deliver drugs at constant rate into systemic circulation via stratum corneum. What are the common sites where we apply these patches? One is in the chest, abdomen, upper arm, lower arm, behind the pinna on the mastoid region and over the buttocks. What are the advantages of using the patch? As you can see, it's very comfortable keeping a patch. It's a non-invasive method and it slowly releases the drug over a prolonged duration. So you get a sustained concentration of plasma drug levels and thereby a longer duration of action. Okay. So there is a smooth plasma concentration, no fluctuation. The effect can last for 1 to 7 days. Less first-pass metabolism, less convenient, less side effects, so more convenient to the patient, and improve patient adherence or compliance. The main disadvantage of transdermal patch is its cost. Okay, and sometimes it can cause local irritation, so you may need to change the site of application. Now, what are the common drugs that we give by transdermal patch? You have hyoscine, which is a drug, it's an anticholinergic drug that we use for motion sickness. Then we have nitrates, we give for angina, nicotine for nicotine substitution during smoking cessation, estradiol, which is a form of estrogen. Okay, so these are the common drugs that we give by transdermal patch. It can be asked as a short note. So if transdermal therapeutic system or TTS is asked, what will you say? First you have to say what is meant by it. That is, you are giving the drug through stratum corneum and it enters into the body by diffusion. Okay. Then what are the drugs that are given? Nitrates, estradiol, nicotine are common drugs. What are the common sites? Chest, abdomen, upper arm, lower arm, mastoid, buttocks are the common sites. What are the advantages, what are the disadvantages, and what are the layers of the transdermal patch? Clear? Now, nasal route, again, we give it either for the local purpose, as in case of nasal decongestants like oxymetazoline drops and all are there. For nasal blockade, we give, or for systemic absorption, we give drugs like oxytocin. Now, inhalational route, you give inhalation route either by using a meter dose inhaler or there is something known as rotahaler. We'll see this more when we discuss about the respiratory system. Or we can give it through nebulizer or specialized devices are there to give it by inhalation route. What are the main advantage of giving by inhalation route? For example, if you take asthma, when you're giving salbutamol by inhalation route, the drug is directly reaching the site where it is supposed to act, that is in the lungs. So we can give a lesser dose rather than when you're giving by systemic route, it undergoes all these first pass metabolism and other metabolism to reach the site of action. Okay. So by giving by inhalation route, it is directly reaching the site. So you can give 1/10th dose. So when you're reducing the dose, the side effects will also get reduced. Okay. So rate of drug delivery can be controlled. The common drugs that we give are anti-asthmatic drugs like salbutamol, inhalation steroids, general anesthetic agents are drugs that we give by inhalation route. So merits, drug is directly reaching the site of action. It has a small dose, more effective, less side effects, rapid action, and no first pass metabolism. Demerits, what will be the probable demerits when you're giving by inhalation route? Throat irritation and sometimes dry cough can be. So next we come to different types of injections. So there are mainly 4 types of injections that you should learn in depth. That is intravenous route, intramuscular route, subcutaneous route, and intradermal route. Okay. So what is intravenous route? When you're administering drugs through the superficial vein. So you can give it either as a bolus injection or a slow injection or as infusion. Okay. So bolus or rapid injection is given when you give the drug as a push. Okay, in emergency situations like diabetes ketoacidosis, you give regular insulin, or you can give it a slow IV, that is by direct IV injection itself, taking over 5 to 10 minutes. Like calcium gluconate or aminophylline injections and all can be given as a slow injection, or you can give it as an infusion. For drugs with short PHAB, when you need a continuous action of the drug, we may give it as an infusion. For drugs like dopamine, dobutamine and all, we give it as an infusion. Now, what are the merits and demerits of intravenous route? What are the merits? It is one route where you have 100% bioavailability. What is meant by bioavailability? We'll see it in the next slides in detail, but just for your understanding, it's a fraction of drug that reaches a systemic circulation at the site of action. Okay, so when you're giving it by intravenous route, there is 100% bioavailability. It is very rapid acting, very fast acting because you're directly injecting into the vein. Okay, you can give it in unconscious patients, those with vomiting or those in shock. Any patients you can give by intravenous route, and any amount of drug can be given by intravenous route, because in case of shock and all, we'll be infusing liters and liters of fluid or blood. Okay, so rapid action, so useful in emergencies, 100% bioavailability, large volumes, even irritant drugs can be given by intravenous route, which we cannot give it by intramuscular or sometimes subcutaneous route. What are the demerits? You cannot self inject by intravenous route, and it requires a skilled person. Highly sterile environment should be there, because otherwise it can lead to infections, and there can be local reactions like inflammation of the vein, like thrombophlebitis is very common. So strict aseptic conditions are very important. It can cause thrombophlebitis. Sometimes it can extravasate to the neighboring tissue, okay, and can result in tissue necrosis. You would have commonly seen these conditions. Then oily drugs cannot be given because you're giving directly to the vein. If you give oily injections, that can form as a emboli. Okay, so oily injections or emulsions or suspensions cannot be given. Self medication is not possible. You need a skilled assistant. So that is about intravenous route. So you should know the drugs, what are the advantages and disadvantages. Now, intramuscular route, when you are injecting the drug into the muscle. Okay. So the common muscles that we give injections are deltoid muscle, gluteus mass, lateral aspect of the thigh are the common sites. You can give NSAIDs like diclofenac, paracetamol, or certain antibiotics like aminoglycoside group. All can be given by intramuscular route. Now, what are the advantages and disadvantages of intramuscular? Advantages, again, rapid absorption. The first pass metabolism is less. Even these oily preparations or depot preparations can be given. So that will act like a reservoir where you inject it and get slowly absorbed from the site. First pass metabolism is avoided, that's why it is rapidly acting. What are the demerits? You cannot give as much volume as you give it in intravenous. Only maximum up to 10 ml can be given. There can be abscess formation or local infection can be there. If you give anticoagulants, hematoma formation is there. Sometimes if you don't inject at proper site, there can be nerve injury, and only up to 10 ml of the drug can be given. That is about intramuscular route. Now we come to subcutaneous route. What is meant by subcutaneous route? Where we are injecting into the subcutaneous tissue. Okay. So it is deposited in the loose connective tissue under the skin. So mainly we give it in the forearm as well as in the abdominal wall around the umbilicus. So common drugs that we give by subcutaneous route is insulin. We all know, people who have seen patients taking insulin will know they give it by subcutaneous route. Adrenaline, heparin are other drugs that we can give by subcutaneous route. What are the merits of subcutaneous route? As you all know, insulin is taken by self. Okay, so self-administration is possible, slow absorption, and the demerits is you cannot give irritant drugs because subcutaneous tissue is rich with nerves, so that can result in pain. Only a very small amount of drug can be given, maximum up to 2 ml. Usually you give up to 1 ml. Repeated injections at the same site, because we are injecting into the subcutaneous tissue, that can lead to lipodystrophy. Either they can be lipoatrophy or lipohypertrophy. That is why in case of insulin, we should keep on rotating the sites. And in case of shock, these peripheral sites will be, vasoconstriction will be there, the drug won't be absorbed. So it is ineffective in shock. The last one is the intradermal route, where we are injecting just under the dermis, just under the skin. This is mainly given for BCG vaccination and for intradermal drug testing. When your test dose is given, for example, in case of antibiotics or NSAIDs, for that matter, any drug, before we give injections, we should do a test dose. So that we give by this intradermal route, where we are injecting the drug just beneath the skin, so that when you're injecting, you can see a welt formation. Okay, and then you mark around it, you observe for 30 minutes whether there is any reactions like hypersensitivity, itching, edema, induration, all this will be noted. If it is there, we will not be giving the full dose of the drug. So that is about the different routes of injections. So as you know, there are based on the layers of the skin which you are piercing, the angle differs. Okay. So when you're giving it to intramuscular, when you're injecting into the muscle, you give it at an angle of 90 degree. Okay. So that is intramuscular. When you're giving it subcutaneous route, you give at an angle of 45 degree. Okay, 45 degree. But the exception is, in case of insulin, we give it using insulin pen. Okay, insulin pen is very small needle. So even if you give it 90 degree angle, it will pierce only up to subcutaneous tissue. So when you're giving people, when you see people taking insulin injection, you might be wondering, they'll be giving at an angle of 90 degree. That is because they use not the ordinary syringe, they use the insulin pen. So even if you give it 90 degree, the needle will reach only the subcutaneous tissue. When you're giving by intravenous route, again the angle reduces. You can see it should just reach the vein. The angle is around 15 to 20 degree, and intradermal is almost 10 degree, or almost very close to the skin. Okay, so this is where intradermal injection is going, intravenous into the vein, subcutaneous into the subcutaneous fat tissue, intramuscular into the muscle. And then we have seen the merits and demerits of each of these routes of administration. Okay, so that is about today's class. So main question from this area is introduction part. You just need to know the definitions, what is meant by pharmacokinetics and dynamics. The main essay question is on different routes of administration and the merits and demerits of each route. Okay, so hope you have understood. Thank you for listening.